We are here at San Francisco, California's Bayview Opera House for a community screening of The Waiting Room, also with a follow-up discussion with a diverse panel. We want to have a community discussion on how healthcare reform is going to be changing the community's outlook and changing how healthcare's outlook will be. And so we'll be having some guests speak on that as well. So I'm Dr. Marcus Lorenzo Penn. So I'm joined here by Dr. Gina Gregory Burns of Kaiser Hospital. And we just want to discuss what's going on for the healthcare reform law. We know that we're going to be sharing about how the public sees healthcare change. We're seeing how healthcare professionals see it and also how policymakers change that. So what have you seen to be some changes for healthcare reform law within Kaiser's organization?
I think Kaiser's actually been looking forward to the healthcare law. I think Kaiser's always been very committed to the community and making sure that healthcare is for everyone in all the different communities that we serve. So we really want to make sure that since our focus is on prevention, we can see how we can expand that to all healthcare.
So given that you work for a health maintenance organization, I would imagine that Kaiser has a lot of changes that are going on in preparation. Could you share with us some of those?
Sure. Actually, Kaiser's been looking forward to healthcare reform. Kaiser's been committed to community health for a very long time, committed to prevention, and we see that there are lots of gaps in the healthcare system. Kaiser's been a model in terms of really looking at healthcare disparities, of trying to figure out different ways to address those health disparities in different communities, coming up with culturally competent care interventions in order to really make a difference. So I think we're looking forward to it. Certainly, as any healthcare organization, we need to make sure that we can address those changes and be welcoming to an unpredictable new group of people who have not necessarily managed to navigate healthcare large organizations. So how can we present a welcoming environment? How can we make sure that we acknowledge what the disparities are or their gaps are in their own care? And how can we make sure that we can really make a difference for them? And I think some of that's unpredictable for a lot of organizations, but we need to be ready. To that end, certainly Kaiser has done internal education for its staff and physicians. Also, we have education for our members as well, because even our members have family members who are uninsured. Certainly sometimes patients come in and ask me, well, what's going to happen to my insurance? As everyone is very unclear right now what the differences are going to be and how it's going to affect them, I think our role is really to educate.
Now, with a lot of the focus of the healthcare reform law being in prevention, you mentioned that Kaiser has a large prevention focus. Have you seen there to be more of a focus, an increase and enhanced focus on prevention now that the healthcare reform law is being further enacted?
I don't know it's only in relationship to the healthcare reform law, but also now that we can look at our own statistics, even internally, we can look at how we can address health disparities better. For years, certainly nationally, we know that there are many health disparities all over the nation, but now we can even look at our own statistics and start developing different programs and best practices that we can put together for our own members and then share them as well outside. So for instance, we're looking at different measures, such as we developed a tool for colorectal cancer screening that we can look at for the Latino and the African American population. So how can we really get people to do more screening and take better care of themselves?
Okay, screening is so important. You know, and also as a physician yourself, have you noticed how your practice will change in delivering care within Kaiser's organization?
No, I don't think there's anything immediate. I think that over time we've been much more focused on quality outcomes, making sure we're reaching all populations, as I mentioned. I think that all of us will have to focus more on how do we reach the community as well, because healthcare is a continuum. Patients will have care outside as well as switching to Kaiser and perhaps out before they actually find a medical home. How can we make sure that patients can make that transition?
So we're going to be viewing the screening of The Waiting Room, which is a day in the life of Alameda County Medical Center's Highland Hospital. You spoke about navigation. Do you see how Kaiser is giving more information to help patients navigate through the system?
We, even just last week and the last couple of weeks, printed out flyers that we had pre-prepared regionally to give to patients in English and Spanish and other languages so that they know who to call, how to access information. Again, I think that's very important. I think educating patients so that they know what their rights are and how to access care is a huge point, and certainly after watching the preview of the waiting room, a big part of it is patients don't know. And when patients don't know what their rights are, when patients are scared, sick, concerned about a loved one, that's when they're more vulnerable. So I think that all of us need to take that responsibility.
And lastly, spoke about being informed, community being informed. How would you say our country has done in informing our nation about the healthcare reform law?
I think any transition in healthcare reform is going to be hard. And I think that it's trying in real time to inform people when the rules of the game are still being put together. So I think it's very difficult. I would hope that it's a little bit broader, but at the same time, I think because there's so much negative energy about healthcare reform and the fears of what it could be, et cetera, it's hard to continually focus on a positive light when it's still politically really difficult.
So true. Well, thank you so much for joining us today.
Thank you. I'm looking forward to it.